Good evening, everyone. Thanks for joining us. I'm Liz Quirantes.
And I'm Jim Grimes.
Tonight we have a special report. The new class of anti-obesity medications have become some of the most sought-after prescription drugs in history.
Now, you've heard of some of them. We're talking about Wegovy, Ozempic, Mounjaro. By some estimates, the U.S. weight loss drug industry could soon generate close to $50 billion a year. And while millions of Americans are taking these drugs, companies, well, they're battling it out behind the scenes over who's allowed to make them.
Bruce Cohen still remembers the conversation he had with his doctor 7 years ago about a new drug to manage his diabetes.
You know, there's something else that's just kind of hitting the market, and it also has a weight loss benefit, because at the time I was about 35, 40 pounds heavier than I am now.
Cohen says it was the kickstart he needed to adopt a healthier lifestyle. Not only did he look and feel better by taking Ozempic, but he became more active.
In the big scheme of things, how much did that medication play a role in your health today?
100%. 100%. Better living through chemistry.
But like millions of other Americans with type 2, Cohen quickly found the medication was getting hard to find.
I have gone a couple of weeks, but...
You mean you've had...
It's a gap.
You've had a gap of a couple of weeks as you waited for this to be refilled?
To be refilled, yeah.
And at that time, what do they tell you?
We'll let you know as soon as it comes in.
At first, drug makers blamed the shortage on pandemic supply chain issues, but the real reason was spiking demand. People all over the world were realizing losing weight could be as simple as taking a weekly shot.
With Wegovy, I lost 35 pounds.
GLP-1s have been really groundbreaking from a weight loss and reversing diabetes perspective.
Dr. Jessica Chen explains the weight loss effect created a stampede for these medications, leaving many people who need them to treat disease unable to get them. So the FDA declared a shortage, which made it possible for compound pharmacies to make the drugs, multiplying the supply.
Compounded medications are the same ingredients, but produced by a compounding pharmacy. And that's only allowed when there's a shortage of the brand name medications.
Now, almost anyone with a weight loss problem can get these medications online or at a local compounding pharmacy for a fraction of the cost charged by big pharmaceutical companies, which invented them. But those multinationals who invested millions to create these revolutionary drugs are pushing the FDA to call off the shortage. Last October, Eli Lilly's weight loss drug Zepbound and Mounjaro came off the FDA's shortage list, and compounders were told to stop making it. But days later, the FDA reversed its decision. And last month, here in Florida, a federal judge tossed out a lawsuit filed by Novo Nordisk, which makes Wegovy and Ozempic. But the drug makers are not giving up. Novo Nordisk telling our I-Team that it's committed to continuing to take legal action against compounding pharmacies and other entities that are putting patient safety at risk by selling unapproved semaglutide drugs with high levels of impurities. The American Diabetes Association shares those safety concerns.
Our stance is until safety can really be established for these products, that we look at alternatives to really bridge people until they're available.
But the trade group that represents many compounding pharmacies, which are doing a booming business in these products, isn't buying it.
Just because they're not FDA approved doesn't inherently mean they're unsafe, even though that's what's being applied a lot in the media.
Tanel Davis says the drug makers have launched a series of false attacks, claiming that drugs are not in short supply, or that the active ingredients to make them is difficult to duplicate safely.
Compounding pharmacies exist under this regulatory framework, and as long as a patient is sourcing, using a state-licensed compounding pharmacy, they can have fairly good assurance that that pharmacy is complying with all of the standards that they're required to.
Meanwhile, the GLP-1 market is exploding.
Get Noom GLP-1.
That's why we created Weight Loss by Hims. 100% online access to GLP-1 injections for as little as $1.99 per month.
Demand keeps growing as more and more insurance companies drop anti-obesity drugs from coverage plans. Many Americans who are losing weight and getting healthier, they can't afford to keep up with the prescriptions, which can cost up to $1,000 a month. That makes the market for cheaper versions from compounding pharmacies even bigger. And the health benefits of losing weight are undeniable, from lowering risk of heart attack and stroke to allowing some people to stop taking diabetes medications altogether, which is what Bruce is aiming for.
The goal is to drop my A1C and become medication-free.
Well, now there's another wild card in play, the new leadership in Washington. HHS Secretary nominee JFK Jr. repeatedly saying that lifestyle changes are the first defense against obesity, but he also believes that these medications, they can play a role in helping people to lose weight. He's repeatedly, however, criticized the high cost. Of course, we'll be keeping an eye on how things play out.